Welcome to the next randomics case of the week. Here we have a CTPA in a 48-year-old male patient presenting with chest pain and shortness of breath. They've got a raised D-dimer and the clinical team are suspecting a possible PE. Now we can scroll through the lungs on lung windows first. Might be a touch of atelectasis in the left base. And as we're coming past the mediastinum, we can see there is the impression of a mass-like density sitting there. We're not really characterising that well on these lung windows, but we will definitely come back and have a look at another point. Lungs otherwise look relatively clear. So coming back to this mass at the left hilum, we've got to try and figure out what its relationship is with the other structures in that area. So we can see as we scroll through the region of the left pulmonary artery here, on lots of these slices it almost looks like the mass is lying within the lumen of the pulmonary artery. If we look on the coronal slices here, we can see that on some of these segments it almost looks like there is a rim of contrast around the outside of this mass, again with the mass looking to lie within the lumen of the artery itself. There are some small areas of calcification within the mass, and we can see really quite poor opacification of distal pulmonary arterial branches on the left side in comparison to at the same level, or those seen at the same level on the right side. They're probably all collapsed down because they're not receiving very much flow. This is a really unusual finding to see on a CTPA. We're really used to seeing thrombus or emboli within pulmonary arteries, but they don't cause this kind of expansion that we're seeing in this case. The calcification again would be quite an unusual feature for an acute pulmonary embolism. You can get calcification in chronic emboli as they remodel. But really it wouldn't be something we would see in the acute setting. So lots and lots of abnormal features in this case. Let's try and just formulate our ideas a little bit using RadChat, see if we can help us come up with something here. So why don't we say something along the lines of differential for calcified, or partially calcified mass within pulmonary artery, and see whether it can help us come up. Okay, so it's talking about chronic pulmonary embolism with calcification. That's what we were talking about. That's what we were talking about earlier, but wouldn't really be seen in the kind of acute setting like we're seeing with this patient. And again, I wouldn't really expect that to be as expansile as we're seeing here. But very helpful reminder. That's probably the most common cause that we may see of pulmonary arterial calcification. Pulmonary arterial sarcoma is rare, of course, but would be a more likely cause of this kind of expansile mass-like lesion that we're seeing in this case. A couple of other things to consider. Okay, so after congenital cardiac repair, wasn't in the history for this patient. Calcifying Mets, again, we don't have a history of that in this patient, but could be worth considering. And then less likely causes, vascular malformations, of which we've got no evidence here. And maybe infective endocarditis, but I don't think that's a consideration here. So I think out of this list that we've got here, we could probably think about pulmonary artery sarcoma first. But let's write a report. Maybe we could say mass centered on the, or maybe we could even say centered within the lumen of left pulmonary artery. Some central calcification. We should probably mention as resulting in obstruction. We could say very poor calcification of distal left arterial branches. What else should we say? I guess we could say lungs are clear other than left basal atelectasis. That would be good. And then we should probably have a look at the nodes within the mediastinum and throughout the scan. Nothing very significant looking. So let's generate a report with this. Okay, so it's stuck that into my CTPA type template. Started off with some commentary about the pulmonary tree. Yeah, and it's put in other aspects of my template there. Okay, I'm happy with that. Let's leave it there. In fact, we should probably say what we thought this was. So, obstructive mass, consistent pulmonary arterial obstruction, and pulmonary arterial sarcoma is the most likely differential. Okay, let's finish it there.